Why does a face and neck lift absolutely need a little incision underneath the chin? Let's take a beach walk. So patients often ask me why this tiny little incision under the chin is required in addition to the meandering incisions around the ears where all the skin is removed. And the answer is this tiny little incision is actually one of the most important parts of the entire facelift. Even though this is a 3/4 inch incision that I carefully hide in that natural skin crease, I do a ton of work through there. And there's multiple components of a good facelift that have to be addressed through that incision in order to get the results that you want. Number one thing that's addressed underneath the chin is platysmal bands. So in order to understand this, you have to understand the platysmal muscle. The platysmal muscle is actually two sheet-like muscles on either side of the neck that interdigitate underneath the chin to create this nice, tight, beautiful jaw contour. And as we age, those little fibrous attachments under the chin start to pull apart. And that creates two separate platysmal muscles, and that also weakens the support we have underneath our chin. So a key component of a face and neck lift is recreating that muscle support, and that's done by addressing the platysmal sling underneath the chin. Number two thing that's addressed through this tiny little incision is platysmal bands. So as we age and those muscles come apart, you start to be able to see the anterior border of the platysma, and that creates this banding appearance. That it makes it for a less defined jawline. It makes for an aged appearance. And so platysma bands also have to be addressed at the time of a face and neck lift. And as part of creating that muscle sling, I actually cut through those areas that are producing bands to adjust the angle and recreate that platysmal sling. The third thing that's addressed underneath the chin is the mandibular ligaments. So the mandibular ligaments are these tight little areas where our skin is attached to the underlying jaw bone. And these are genetically determined. Some people have tighter or longer ligaments than others, and you can tell that based on how big of a dent you have on either side of your chin. And so those areas of attachment are what causes the skin to collect underneath the chin, and people with tighter mandibular ligaments often have a more defined skin fold underneath their chin. So it is important in many patients to fully release those ligaments to allow that skin to mobilize and come upwards with a deep plane facelift. The fourth component that's addressed through this tiny little incision under the chin is the deeper structures of the neck. And these include deep fat pads, some of the lesser muscles, and glandular structures. All of these tissues can be addressed in terms of resection or repositioning as part of a structural deep plane neck lift. What is not performed through this tiny little incision underneath your chin? It is skin removal. So a lot of people are surprised by this because there's still this perception that a facelift is mostly removing skin. Absolutely no skin is removed through this tiny little incision because that is counterproductive to the entire goal of what I am doing here. I am creating that muscle sling that pulls upwards. And so if skin is removed, it's pulling that skin forwards, and it will actually bowstring or blunt that neck angle. So when I see patients for consults that have had prior facelifts elsewhere and they have a big U-shaped incision under their chin, you know that something went terribly wrong in terms of the entire understanding of what's going on with those neck tissues. All of the skin that is mobilized underneath the chin is actually removed way up here in these meandering facelift incisions. So hopefully that helps in understanding what's going on underneath the chin. I appreciate you coming on this beach walk with me this morning. If you have any other topics you'd like to hear me cover in one of these, please leave them in the comments below, and have a good day.